40 years ago, 35 years ago, I started playing tennis, and of course, tennis is pretty rough on your knees, and that's exactly what happened last year. As I began, the last 2 years actually, I've been having a lot of pain in my right knee, and we finally wound up to where Dr. Lane told me, he said, not much else you can do other than you can only have so many cortisone shots per year. Therefore, it was time. He said just total replacement is about your only option at that point. And that's when I came to Dr. Barber and his staff to evaluate me and to see what we could do about the replacement. So I think it was in February that we did that. He recommended at that time, once I got scheduled for surgery and the 6 weeks for building the knee, the Conformis knee, to do pre-op therapy. I did go ahead and do probably 2 weeks of therapy before the operation. Did therapy in the hospital the day that I was there, the 2 days I was there. And then, of course, I did home therapy for 2 weeks. They recommend home therapy. As Dr. Barber explained it to me, that it tends to get the muscles and tendons and that somewhat conditioned or stretched so that the surgery usually is more successful and probably less cumbersome or painful such after recovery. So I think that that plays a big part. Of course, I was very religious, I might say, that when I did do all the therapies, even the home therapy, I did more than I was asked. I usually did in between. After I do the therapy three or four times a week, I would come home and do therapy as well. Approximately 6 weeks out, I called Dr. Barber and asked him if I could go back to playing tennis. I felt I was mostly healed and most of the pain was gone, and I wanted to get back to tennis. He said that I could go back and play tennis. I could have hugged the guy, and I did hug him. I really appreciated all that he did, and I think he's an extremely capable, a very top-notch surgeon, and so I do recommend him and the Conformis knee to everybody and anybody that is in that situation.